Welcome to today's press briefing. We have two doctors with us today. Dr. Albert R., Principal Medical and Health Officer, Communicable Disease Branch, Centre for Health Protection, and Dr. Sarah Ho, Chief Manager of Hospital Authority. They will give you an update on HA situation and COVID cases. We give the floor to Dr. Ho. Good afternoon. There are 2,290 patients in our facility. 245 of them are newly confirmed cases. For those requiring isolation facilities, there are 1,146 of them. And yesterday, we reported 3 more patients in critical condition and 4 more patients in serious condition. And among the infirmed, 49 are in critical condition and 41 are in serious condition. 20 patients in critical condition are receiving intensive care. As for death cases, we have reported 17 new cases involving 9 males and 8 females aged 55 to 99. Among the deceased, 12 of them did not complete the 3-dose vaccine regime. As of yesterday, 345 patients have recovered, including 305 patients who have been discharged. And we also have another announcement. For the Orthopedic and Traumatology Department of Caritas Medical Center, on the 19th of September, an 87-year-old female patient had fever and coughs. She tested positive. The hospital started contact tracing then and has discovered 6 more patients and 6 staff members testing positive. There are also 2 other patients listed as close contacts, and they'll be isolated, quarantined, and the 7 confirmed cases are now in stable condition. And the hospital has arranged for all patients in the same ward and staff members to be tested, and the ward has stopped receiving new patients, and it has also been thoroughly sterilized and cleansed. And the hospital will continue to monitor patients and staff's condition. Good afternoon. I'd like to give you an update relating to COVID cases as of the 21st of September. As of yesterday, we recorded 5,827 local infections, including 1,466 PCR positive cases and 4,361 RAT positive cases. We also reported 163 imported cases yesterday, including 149 PCR positive cases and 14 RAT positives. And yesterday, as Dr. Ho already explained, we received 17 more death cases, and so far, in the 5th wave, we've recorded 9,721 deaths. Among the 163 imported cases, 58 were picked up at the TSCC at the airport, 57 picked up in quarantine hotels and quarantine centers. As for the remaining 48 cases, they were picked up in community testing centers, and 43 of them belong to specimens collected between day 4 and 7, and also 5 other specimens collected after day 7, and 40 countries reporting imported cases. In UK 29 cases, Nepal 21, and Thailand 21 cases, and the Philippines 24. These 4 countries have imported more than 10 cases. As of yesterday, 7 residential care homes recorded new cases, and some residents will be listed as close contacts, including 5 RCHEs involving 1 resident in each of the 5, and also 2 RCHDs involving 2 residents, respectively, in these 2 homes. Altogether, 28 residents in these 7 homes have been listed as close contacts, and they will be quarantined. In the past 7 days, we've recorded 36 homes with cases. During the period between the 15th and 21st of September, 23 RCHEs and 13 RCHDs involving 45 residents and 1 staff member. We understand that the infections relating to homes are coming down. And comparing to the week before, that is between the 8th and the 14th of September, when 56 care homes had cases, and also the week before, between the 1st and 7th of September, 52 homes had infections. As for schools, this morning, From yesterday afternoon to this morning, we've received 746 reports, 636 involving students, and 110 belong to staff members. Altogether, 520 schools are involved, including 102 kindergartens, childcare centers, 207 primary schools, 197 secondary schools, and 14 special schools. And among the schools making reports this morning, there are 336 schools which reported more than 2 cases in the past 7 days. 18 schools had the clusters of cases in some of the classes, and we've advised them to be suspended, and they include 5 kindergartens, childcare centers, 5 primary schools, 8 secondary schools. That means in these 18 schools, 1 class from each of these schools will have to be suspended. As for the previously reported schools, 3 more classes have had cases recorded, and these classes will have to be suspended as well. As for subvariants, the Public Health Laboratory Service conducted analysis, and for L452R, the percentage now stands at 84.9%. So that's similar to the 84.8% recorded the day before. So BA.5 now accounts for 78.36% of all cases, BA.4, 6.54%, and then for the remaining subvariants, BA.12, 2.12.1, 4.3%, and then BA.2.2, 10.8%. So BA.5 now accounts for close to 80% of all infections, and that's quite a high level. We believe the main subvariant in circulation in Hong Kong is BA.5. And recently, the rise in the number of BA.5.4 infections have slowed down, and perhaps we have reached a peak. In the past 7 days, the percentage of BA.5 has risen by 6.7%. In the previous 7-day range between the 6th to 12th of September, the percentage was 14.49%, and then the week before, 15.8%. So perhaps we have reached the peak. The floor is open. Please introduce the media outlets before you speak. This lady at the back. Good afternoon. I'm from TVB. The first question is for Dr. Au. According to what you said just now, it seems we have reached the peak. So in terms of travel restrictions, yesterday, Dr. Zhang also agreed that it's time for a review, seeing that the figures have come down. Is it still 0 plus 7 on the table? Because according to experts, we can have 0 plus 3 or 0 quarantine. What is your view? Would this bring huge risk to the community? The second question, some private clinics have issued exemption certificates indiscriminately. What is the view of the matter? Because does it show that some members of the public are concerned about side effects of the vaccine? Is there a responsive plan? And then a question for the HA. Professor Low, the secretary, said that public health services should resume to 80% of the full capacity before the restrictions can be relaxed. So at what percentage of the full capacity are we talking about now?
When Dr. Low met the media, he already explained this. In terms of the COVID situation, we are witnessing a downward trend. To look at some statistics over the past 7 days, now if you look at the 7-day rolling average, as of yesterday, 21st of September, 6731 is the average daily caseload. On September 8th, it was 10,090. We are looking at an obvious downward trend. Since September 8th, the 7-day rolling average is registering a steady decline. This has been going on for about a fortnight now, so it is pretty obvious now that the peak is really over and the COVID situation is trending down. In terms of sewage surveillance and also hospital admission numbers, they are stable and they are actually trending down also. Also, BA5 is taking up a pretty high proportion. And in the light of overseas experience, and BA5 is hitting something like 80%, it would be hitting a plateau, and the caseload in the community will be coming down on a gradual basis. So we can see that the COVID situation has stabilized, and this is a golden opportunity for us. For those who are unvaccinated or under-vaccinated, the elderly and the young people, they should go get the jab as soon as possible so that we can be resuming our life to normal. As to the inbound travel requirements, the CE and the Secretary have already explained this. Under the condition of COVID control, we would like to be reconnected with the rest of the world, and we are working hard to review the measures and the statistics. No decision has been taken so far in relation to the measures. The government is prepared to look at all the measures as long as we can control the COVID situation. The last question is about the vaccination exemption certificate. Now, the COVID vaccines, there are enough evidence to show that COVID vaccines are very safe. For those who are unfit for vaccination, the number is really minuscule. Now, for those who have experienced allergy or who have really suffered from a serious allergy, they are unfit for vaccination. For BioNTech, there were people who suffer from myocarditis or pericarditis, and they're unfit for this vaccination. And for Sinovac, there are some people who may be unfit for vaccination as well. But in general, even for the chronically ill, for those who have underlying conditions, these vaccines prove to be safe. If there are any doubts, the members of the public should seek advice from their family doctors, or they should solicit medical advice from doctors. And people should not go to different places to look for the vaccination exemption certificate. The DH will be monitoring the situation, and where necessary, we will refer the cases to the police for action. In terms of infection and also hospital admission, the number has been coming down in recent times. We will monitor the COVID situation, and in fact, in recent times, we are taking measures to readjust the services. Towards the end of August, we have started the hospital bed mobilization plan, and we are making adjustment now. Some of the beds reserved for the COVID positive patients will be redeployed to other patients. For the non-emergency services that have been suspended, they will be brought back to into service. But we will maintain the flexibility. Where necessary, we should be able to deploy the community treatment facilities to look after the COVID positive patients, like the North Lantau Hospital and the AWE COVID treatment center. Next, please. Well, we will be making the mobilization on a gradual basis, and it will differ from hospital to hospital. Cable news. We're looking at imported cases, 160-odd cases. 1/3 of them were picked up at the airport. And if I may put a question to the CHP, if the inbound restrictions are relaxed, if people test negative, they can leave an airport pending the results, would there be any loopholes? Another scenario is before boarding, if there is no need for PCR tests, and if we adopt the RAT, would there be any risk of importation of cases. It is rumored that 0.7 might be brought into place next month. Do you think this is the right time for us to relax the requirements? Now, with the COVID situation on a downward trend, do you think that the daily caseload will remain at 4 digits? How do you define the end of this wave of COVID? Right, thanks very much for your question. The first one is about the prevention of imported cases. Professor Lo Chung Mao has already said that the government is monitoring the statistics in contemplating various measures, and discussions are taking place with various bureaus and departments about the details. So there is no definitive conclusion and decision regarding the measures. Once the decision has been taken, there will be an announcement soon enough. And we will consider the inbound travelers, their pre-boarding test and also the test on arrival and so on. If we shorten the hotel quarantine and what the measures are going to be, we'll have to make sure that if there are positive cases coming to Hong Kong, the overriding principle is to be able to identify these cases for isolation, in order that these cases will not be finding their way into the community. We will be announcing the details as the time comes. The second question is about the COVID situation. The daily caseload is on a downward trend. It is anticipated that the trend will continue, but this is not happening in a really rapid way. Another issue is that there are certain groups or groupings, the children and the elderly people whose vaccination coverage is not high enough. Even for those who are vaccinated, the immunity will be waning with the passage of time, and BA.5 is going to be circulating in the community continuously. And however, the COVID situation will stabilize. As to what level it will be coming down to, we are not sure yet. As to at what level would we say that the COVID is under control? In the since the fifth wave, we may not be able to achieve zero COVID. Next, please. Speaker not coming through. Next, please. There will be discussions in the government. AM 730. This is for the HA. Now, for the deceased patients, did they die of or die with COVID? And also the AWE hospitalized patients. Can you tell us the numbers? And also the fake exemption certificate. Does the CHP monitor the situation regarding the issuance of the exemption certificates? If there are any anomaly, will you refer the cases to police for follow-up action? Now, Dr. Au, you said that this is a good opportunity to get vaccinated. Now, Professor Yuen Kwok Yung said that if people leave it too late to get vaccinated, there is the incentive will be disappearing. Do you have any statistics about people testing AT negative and then test PCR positive subsequently?
Thank you for your questions. About vaccination exemption certificates, all registered medical practitioners, after making an assessment and find the patient unsuitable to be vaccinated, he should follow the Department of Health's guidelines. And if the patient is deemed unsuitable, then through the e-health system, such a certificate can be issued. The certificate has a QR code and the period of validity depends on the clinical judgment. We understand that we do have information on the number of certificates issued by each registered practitioner. So after a doctor decides that the patient is unsuitable to be jabbed, if we find the situation to be irregular, because the percentage of the population unsuitable for vaccination should be small, the case will be referred to the police for follow-up. And about cases identified at the airport, we understand that some have tested RAT negative. All inbound travelers on arrival must be subject to two tests, RAT as well as PCR. If the RAT result is negative, he can go to a hotel and wait for a PCR result. The majority of cases picked up at the airport had originally an RAT negative result. And upon arrival at the hotel, he would be sent to an isolation facility. And there are some cases, such as repositive cases, and they may have infection records overseas. And for those with lower CT values, they may be new infections. This is within our expectation because we do note that RAT has a lower sensitivity. Only when the viral load is high would the RAT test positive, whereas PCR is a much more sensitive test. So it is normal to have a negative RAT and positive PCR. Depends on the number and also how many certificates have been issued by a particular doctor during a period of time. We do not have this information. We have 382 patients in isolation facilities, 150 in second-tier wards, and 439 patients in North Lantau Hospital, Hong Kong Infection Control Center, and 175 patients in Treatment Center for COVID in Asia World Expo. About the patients who passed away today, the majority of them died because of COVID and because of their own underlying illnesses. There was one patient, 58-year-old patient, who was admitted to hospital because of stomach pain. And then because of acute necrosis of the intestines, he passed away. The CT value is relatively high. And our team will review the cause of death of each case. But it seems that the deceased patients in this case had more to do with the intestinal issue. It's a male patient. I'm from Mingpao. About infections, according to Dr. Au, the trend is edging down, and for the past few days, the daily caseload is about 5,000. Is it coming down at a very slow rate? And is there a target to achieve zero infection? If we are to relax social distancing measures, what is the target, and will there be a rebound, or will we hit a plateau? And also, are there measures that you are not going to relax, such as mask wearing requirement? Would you continue to make it mandatory? And before relaxing the measures, it is said that you will boost inoculation for the young and the old. And do you have any targets, such as 70% of those above 60 or below 12? For Taiwan next month, they will also be relaxing the quarantine measures to 0+7. Will they pose a risk to Hong Kong? Thank you for your questions. We closely monitor the trend every day, and in fact the downward trend started roughly on the 8th of September, and we understand that the trend has been coming down since at a rather slow rate. It's not a rapid drop. So judging from the current trend and the number of infections, we do believe that in the in a short period of time, the situation should continue. But it's hard to predict whether with relaxation of measures, should there be such relaxation, whether we'll hit a plateau. We need to give consideration to the overall epidemic situation in Hong Kong, and I believe this would mean the infection numbers coming down and the trend coming down, together with fewer severe cases and fewer hospital admissions, so as to alleviate the pressure on public healthcare systems, so that we can sort of return to normalcy for public hospitals. So these are principles the government will bear in mind. While the number of cases comes down, there would be room to relax certain measures. The second factor is vaccine coverage. If it goes up, it means we have better protection, and the risk of increasing transmission may be real if we relax certain measures, but then we should be able to control hospital admission figures. As for the vaccination target for adults and adolescents, the vaccination coverage is good enough. Perhaps for the 3-jab regime, we have reached 80–90%. However, we are worried about children below 11 years of age and the elderly. The vaccination coverage is not good enough, especially for toddlers from 6 months to 4 years, and also seniors above the age of 80. Once infected, the fatality rate is particularly high for these two groups. So this is our concern. If there is a rebound of the epidemic situation and increased transmissions, these two groups may pose a pressure on the public hospital system, and we will keep in view the situation. About the other point, the government is considering fine-tuning certain arrival arrangements to enhance connectivity and to facilitate inbound travelers. I believe that any decision will be announced in due course. This is the end of the press briefing.